Welcome to the Speaking of Women's Health podcast. I'm Dr. Holly Thacker, the Executive Director of our national nonprofit Speaking of Women's Health, and I am happy to be back in the Sunflower House. And I am so happy to introduce today a guest podcaster, Sylvia Morrison. Sylvia is a retired marketing executive, and she's actually worked on Speaking of Women's Health. And she lives our motto: be strong, be healthy, and be in charge. This is not medical advice, but it's certainly edutainment, and it will help empower you. So I hope you enjoy some excellent information from Speaking of Women's Health.
Welcome to the Speaking of Women's Health podcast. I'm your guest host for this episode, Sylvia Morrison. For those of you who have not had a chance to tune into my prior guest podcast episodes, I'm a retired Cleveland Clinic marketing executive, and I worked closely with Dr. Thacker on the Speaking of Women's Health program during my time at Cleveland Clinic. I am thrilled to have the opportunity to talk to you today about tips for scheduling your next doctor's appointment and how you can make the most of your appointment. Dr. Thacker wrote a column on speakingofwomenshealth.com entitled Tips to Help You Make the Most of Your Doctor's Appointment, where she shared her insider tips on how to be best prepared for appointments and making the best use of the time you have with the physician. Going to a doctor's appointment can be very intimidating and sometimes a bit scary, especially if you're seeing a new physician. Many patients are afraid to visit a doctor, delay making an appointment because of fear, forget what they want to ask once they're in the exam room, and leave the visit with more questions than they came with. Here are tips to help you make the most of your doctor's appointment, starting with scheduling the appointment to what you should do when you get home from an office visit. Number 1, scheduling the appointment. Try scheduling the first appointment of the day. The first appointment of the day minimizes any waiting time. Also, when scheduling an appointment, be clear with the scheduling person on why you need to see the doctor. Mention if you are a new patient so they can get all of your information and describe all of your symptoms so a specific amount of time can be set aside for you. Mention if you have a sore back, sore throat, etc. Describe all of your symptoms. And finally, does your doctor's age match yours? Long-term medical conditions like high blood pressure, diabetes, or cancer require lifelong care. Select a doctor who will be there for you over an extended period of time. Next, be prepared before the appointment. Know the office location. Be prepared by getting directions to the office beforehand and knowing where to park. Ask the expected arrival time. Many physicians' offices will ask new patients to arrive 15 minutes early to fill out paperwork. Know what to bring with you: insurance card and/or Medicare/Medicaid card and your driver's license. Also, make your wait pleasant by bringing a favorite book, magazine, or some home or office paperwork. Consider taking a friend or relative with you if you're nervous. If you need a translator, do not rely on a child to translate. Check with the office to see if a translator is available. Dress appropriately. Loose, layered clothing that's easy to remove, as offices are often cold. Compile your medical history. Make written lists of the medications you are taking, including the name of the medication, dose, number of doses per day, and reason. For example, atenolol 50 milligrams, 1 tablet daily for high blood pressure. Always include any over-the-counter medications, vitamins, and herbal products that you're taking. The appointment day is here. Doctors usually have an average of 15 minutes per patient visit, so the better prepared you are with information helps the doctor use the time with you to diagnose and discuss any questions or concerns you have. Please turn off your mobile phone when you enter the exam room. Share your surgical history. Your physician's office will want to know if you've had surgery in the past. Make sure to share what type and when, for example, total hysterectomy in 1989. Make sure to also mention all of your medical history, such as heart disease, diabetes, cancer treatment, etc. Be honest while talking to your physician. Don't hold back any information, even if you might consider it embarrassing. The more information you share, the better the doctor will be able to figure out what's wrong and how to treat you. Make sure your doctor gives careful attention to detail without rushing through an evaluation. How to describe symptoms to your doctor. If you are suffering from back pain, below are some questions your doctor might ask you during your appointment and suggestions on how to describe your symptoms. Question from the doctor, where does it hurt? Answer from the patient, left neck. Question, what does it feel like? Answer, dull ache. Then the next question, when did it start? The answer, when I bent down to pick up a box a couple of days ago. And finally, what makes it worse or better? Answer, turning my head. After speaking to the doctor, what's next? The doctor may wish to perform a physical exam. The doctor's exam is guided by the information you and he or she discussed during the history taking. The doctor may decide you need additional tests and or a referral to a specialist. If medication is prescribed, if medication is recommended and prescribed, make sure you leave the office visit understanding your doctor's instructions. Here are some suggested questions to ask. What side effects should I expect? How long do I take the medication? How do I take the medication? At home after a physician's appointment. When you arrive home from your appointment, follow these 3 steps to assure you understand and follow your doctor's instructions. 1. Review the materials you received from your physician or nurse. If you don't understand something when you get home, call the office and ask questions. 2. Call the doctor's office if you're not feeling better. And 3. Follow your doctor's instructions, take the full course of medication, go for additional testing if ordered, and keep your follow-up appointments. Scheduling a doctor's appointment can be overwhelming and sometimes really difficult. The physicians hear from so many of friends and family that they can't get an appointment with their doctor for 4 to 8 months. Everyone's favorite department coordinator in the Women's Health Center, Ms. Rhonda Jackson, wrote a wonderful column on speakingofwomenshealth.com sharing her insider tips on how to be prepared when scheduling your next doctor appointment. The question is how to make an appointment. At Cleveland Clinic, appointments can be made online or by phone, and this is the case for most hospitals across the country. The Cleveland Clinic has multiple ways to make an appointment. 1. Request an appointment online. 2. Schedule an appointment in MyChart. Or 3. Call the appointment center 24/7, including holidays, at 866-320-4573. Again, 866-320-4573. When to call versus when to make an appointment online. Are you trying to decide when it's best to call or when it makes more sense to schedule the appointment online? We recommend, if it's your first time seeing the healthcare clinician, to call and schedule the appointment over the phone, especially if this is a consultation. If you're scheduling a yearly checkup, for example, a gynecology exam with a nurse practitioner, an ongoing appointment for follow-up, or a mammogram appointment, you may find it easier to do that online via Cleveland Clinic MyChart. The Center for Specialized Women's Health Director, Dr. Holly L. Thacker, encourages her established patients to schedule their telemedicine virtual appointments for yearly hormone therapy reevaluation and prescriptions via MyChart, as it can save time and convenience. But if you have any questions or concerns, you can always call to schedule your appointments, especially if they need to be coordinated with a bone density or multiple visits. How much will the appointment cost me? At Cleveland Clinic, they know navigating the insurance coverage process can be an added stress, and we strive to make the process as smooth as possible for patients. If your insurance plan is not accepted at Cleveland Clinic, or if you do not have insurance, what's called a self-pay patient, a patient financial advocate will meet with you prior to scheduling your appointment. How do I know if the doctor I am scheduling with is covered by insurance? Cleveland Clinic accepts a variety of plans from insurance companies at all locations. To verify if your insurance plan is accepted for services across the health system, please review the list of accepted insurance companies. If your insurance company is accepted by Cleveland Clinic, it's best to contact your insurance company to confirm what care is covered by your plan, as well as information on co-payments, deductibles, and co-insurance amounts. If your insurance company is not accepted by Cleveland Clinic, this means your insurance plan is considered out of network, which can lead to greater out-of-pocket expenses for your care. We recommend you contact your insurance company for more information about what your financial responsibility may be if you choose to receive care at Cleveland Clinic. How do I find the right doctor? Finding a new doctor can be overwhelming. A good place to start is by visiting Cleveland Clinic's Find a Doctor tool. The online search tool allows you to filter by name, location, and specialty. Another way to find the right doctor for you is by asking your primary care physician for recommendations. Your PCP knows your health background and needs, so they can usually point you in a good direction. Can the appointment scheduler refill my prescription? The short answer is no. Rhonda Jackson says that she wishes she could do everything for the patients, but unfortunately, schedulers do not have the credentials to refill prescriptions or answer medical questions and concerns. Please be sure to communicate these questions with your doctors and nurses via Cleveland Clinic MyChart or by calling your physician's office. Cleveland Clinic schedulers can help you schedule your appointment with a healthcare clinician that can assess your medical concerns and needs, from tests to therapies. Non-emergency medical questions and concerns can be sent to your doctors and nurses via MyChart. However, for complex questions and more in-depth care, you should bring a list of questions, concerns, and needed prescriptions to your appointment. Please do not forget to bring any outside labs, pap smears, or records that you want reviewed. That way, you don't forget to discuss them with your physician. Thank you for listening to this episode of the Speaking of Women's Health podcast, tips for scheduling your next doctor's appointment. If you don't already, please subscribe to the Speaking of Women's Health podcast on iTunes, Google Podcasts, Spotify, or wherever you listen to your podcasts. We hope you enjoyed this new episode and you learned some things. And if you did, please leave us a 5-star review. See you soon for a new episode.
Well, thanks for listening. You have been listening to the Speaking of Women's Health podcast, and I'm Dr. Holly Thacker. If you've enjoyed this episode and you want to help support our podcast, please share it with others. And you can donate to our nonprofit on speakingofwomenshealth.com. You can also leave us a 5-star rating and review. And to catch all the latest from us, you can subscribe to this podcast on Apple Podcasts, Google Podcasts, Spotify, Stitcher, iTunes, iHeartRadio, or RadioInfluence.com, or anywhere you catch podcasts. Thanks for joining us at the Sunflower House, and we'll see you next time.